Welcome to the podcast, Beyond Expectations, Parenting Autism. Follow Michelle Shabola's journey of raising a child with autism, the challenges, victories, and rewards. If you're a parent, caregiver, or simply someone seeking to understand autism on a personal level, you're in the right place.
All right, here we are, Beyond Expectations, and we have a special guest today, Suzy Heights, currently works as a speech language pathologist. So Suzy, welcome to the show.
Thank you so much, Michelle. It's a pleasure being here.
Welcome, welcome.
Thank
All
you.
right. I know my first question. What the heck is a speech language pathologist? It doesn't seem like a CSI unit.
Very good question to start with. And I have to say that speech language pathologist is also synonymous with speech therapist. I go by speech teacher. I go by Miss Suzy. I go by a lot of different titles. But basically, a speech language pathologist is a professional who is educated and skilled with working with individuals who have deficits in communicative disorders. So communication involves quite a few areas. So a speech language pathologist is trained to work with individuals who struggle with expressive language. So speaking in clear sentences, using correct grammar, getting their wants and needs met. Also deficits in receptive language or comprehending spoken language. We can also work with individuals who struggle to learn how to make particular speech sounds. We call that articulation. And that's a lot of times what people think that speech therapists do is we work with the S and we work with the L sounds and the R. That's a biggie. Right. I do have a lot of students working on R. But it's so much more than that. We can work with individuals who are disfluent, and we teach them advocacy and confidence in their speech and communication abilities. We can also work with individuals with a lot of different diagnoses, such as autism, ADHD, sensory difficulties, individuals who are struggling with behavior regulation, and social communication deficits. Actually, that's my jam. That's my passion. I love working on.
Tell me about that. The specialty for social, what'd you call it? Social communication deficits?
Yes. So we also call it pragmatic language. So it's basically what people do all the time. Social reciprocity. So having a conversation. I teach my students that a conversation is like a ping pong game. So the ball always has to go back and forth. And there's a 20-second rule. If you're speaking longer than 20 seconds, and sometimes my students on the spectrum will do that. If you're speaking longer than 20 seconds, you're being a conversation hog and you got to pass the ball to your conversation partner.
Oh, interesting.
Mm-hmm. I don't even want to know about that.
Oh my Lord, I've got a clock here.
I met Suzy for dinner. I'm like, oh my gosh.
Exactly. This is where you reveal our diagnosis to us.
Tell me about the ping pong.
I actually have this button. It's called the blah blah button.
Yep.
And once I've been working with a student for a while, and these are my older students, typically diagnosed with autism level 1. So if they're talking over 20 seconds, I'll hit that blah blah button, and it goes blah 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 blah. So it's a fun way to increase awareness and work on that skill.
Oh, that's fascinating. Yeah. Excellent. So part of our discussions here are always like the inspiration for Michelle to put together this podcast is to help parents, right? So people get this diagnosis, and when Michelle got the diagnosis, none of us knew what it meant. We didn't know what to expect. We didn't know what kind of capabilities to expect over time. And there was a lot of fear and panic. And then, of course, Michelle was Michelle and kind of dug in and has had an amazing outcome with Gregory. So maybe start there with like a parent with autism, or a parent with a child with autism, like in terms of communication and speech, what are those building blocks? Or is it even a fair question? Is it such a broad set of circumstances for each child that you have to kind of go back into where to begin?
Well, of course, every child is different. Every child and every child diagnosed with autism is different and have different needs. I always tell my parents that you are the expert of your child. And I really rely on their reports and what they're hearing at home and what they're seeing at home. And of course, you want data and information from a variety of different environments. So if you suspect that your child has autism, and you know what was I got my speech and language license 25 years ago. So the diagnostic criteria has changed in 25 years for autism, but it's still we're still.
No.
Sorry, I can tell I bumped out a second.
Right.
There's still going to be that social communication deficit in that social reciprocity. Is my child looking at me when I'm speaking with them? Are they trying to communicate to me when I'm speaking with them? Is there eye gaze? Are they tuned into my facial expressions? That's a big one because oftentimes individuals on with autism will have difficulty reading those nonverbal language um, signals that we give off all the time. So much of our language is nonverbal, and just their ability to make relationships with other kids when you bring your child to playgroup or to the park. Do they gravitate towards other children, or are they playing in a more solitary way? So these are all
All kind of tips and clues that
yes, to look out and
they
to
might
watch
need
for.
help. Wow. And so when it comes to speech, Michelle, I remember we talked about Gregory's speech. So Gregory spoke really late for a child, right?
Really late. Yes, I told Susie. She knows about craniosacral therapy and loves it, and we talked a lot about it. But yes, he was, and that's what we were just talking about. He was really far behind. We take language for granted. We really do. From the time they dad, mama, and he never did that. So,
Right.
and those are all building blocks, and those are also
Mhm.
building blocks on how to say certain words and speak. And yeah, he was really far behind. He really was.
So at what age do kids normally start working with you, Suzy?
Well, to be honest, infants can start working with a speech language pathologist if there are difficulties with swallowing, feeding, if there are difficulties with hearing. Newborns are screened for
Oh,
hearing
wow.
at birth. I'm nearly positive that is the case in Texas. I should
Mhm.
look that up though, just to make sure. They should be. They should be. But I mean, I would say that typically when the parent is starting to realize, my child doesn't have any spoken language, kids typically start developing single words at the age of 1. Like Michelle said, they're going to start babbling. 6 months, you should hear a lot of that da da, ma ma, the gross motor. Babble sounds. And then, but by the age of 1, I mean, there is a range for sure. But by that time, you should be hearing some approximations and some words, maybe dada or maybe wah wah or more. And then by the age of 2, we want to see them putting 2 words together. So, and I know because I've heard it so many times. Oh, he's just a late talker. Oh,
Always told that.
his big sister talks for him all the time, so he doesn't
Mhm,
have to talk.
mhm,
And it sometimes, like I said, there's a range, and kids are a little bit later developed to speak. Maybe there are 2 languages being spoken in a home, which, thank goodness, back when I was in graduate school, I mean, there was kind of like maybe we shouldn't learn that second language if a child is struggling to develop a first language. But
mhm.
now we know that second language should be taught in the home, and it's so important if you want your
And you
child.
go ahead and you do go ahead and expose them to both languages right away. You
Yes.
don't. I thought you were gonna say it differently. I thought you were gonna say focus on the one and then pick up the other one separately. No, you go
No, that was, like I said, that was being taught to parents to take away a language a couple decades ago, but no longer. But if you feel that your child is late in developing to speak, start with your pediatrician. And then reach out. You can reach out to your school district when your child is of preschool age. And you can, if you contact the special education department, you can reach out and get a free speech and language evaluation through the public schools. And you could, if your child qualifies, they can receive speech therapy through the schools. And even if they don't qualify, if you feel that your child needs services, you can also reach out to a private speech language pathologist and go that route.
So I think I understand what's going on, but maybe talk about like what is treatment? What are services? What does this session look like? And then maybe like how much of the work is done with a therapist and how much of the work is done sort of as homework.
Sure. Yep. Luckily, I can tell when I bump out.
Okay. Welcome to Liberty Hill.
So every child who receives services needs a diagnostic evaluation. So an evaluation will include, depending on the concerns of the parent or whoever is recommending this evaluation. It could include a full language evaluation. It could include articulation and phonology, just the sounds. But it definitely should include standardized testing as well as more functional or informal testing, getting a language sample when the child is playing or when the child is doing something a little bit more spontaneous. That's a really important part of the evaluation, as well as checklists completed by the parents, completed by the teacher, whoever is most familiar with the child's language abilities. So once the testing is completed, the speech language pathologist will write up a report with conclusions and recommendations. So frequently the evaluation will lead to a diagnosis, whether it be an expressive language delay or whether it be an articulation delay. The schools can diagnose autism. That's important to know. And autism can also be diagnosed privately by a psychologist. But if you go through the schools, it's a little bit more academically based, educationally based, which is good for the child because the child will be in school. Okay, so
sets them up for the services that they need.
Exactly.
But I guess so I'm a super linear thinker. When I think about speech training, is it literally like physical speech training, like stick your tongue out, don't stick your tongue out? Is it that fundamental?
Yes, absolutely. Yeah. So if you get through the diagnostic process and the speech language pathologist is recommending treatment, if a child is struggling with articulation, part of the evaluation is also a thorough oral motor examination, which looks at all of the structures as well as the functioning of the speech mechanism. So we do, and that's what we're trained to do. We're trained to know exactly.
It's like a whole mechanical side of this thing.
Yes, that's I love being a speech therapist. It involves.
Is it like teaching someone to sing, or you have to like? 'Cause I know I sat with my daughter when she took singing lessons, and they worked on, sing from here, not from here, and not from your nose. Is it that kind of thing?
Sure. Yes, I work on diaphragmatic breathing with some of my students. Yes, and especially with my students with autism, we work a lot on what's called prosody, which is that melodious rise and fall when we're speaking, when we're excited, when we're asking a question.
Is it common? I know that like the Big Bang Theory has kind of made an autistic character a mainstream thing, right? Kind of like we talked about a long time ago. Rain Man was kind of, I think, the first time that a person with autism was like a main character in a movie or something.
Yes.
So now in the Big Bang Theory, they always have Jim Parsons' character just blah blah, very monotone.
Very monotone.
Right.
Right. And is that a trait of someone with autism? And then but can it be fixed to where they're
Yes, I have a couple of students working on that right now. So I call them voice hills. So I say, okay, right now your speech is sounding like a robot. We're going to work on voice hills. And I always give visuals.
Okay.
Whenever you're teaching a skill, as much as you can make it visual is going to be so helpful for any child. I try to include visual, auditory, and tactile when I'm working with the child, trying to let them touch something or, touch their own mouths, feel vibrations, things like that. It's funny you should mention the Big Bang Theory because Sheldon does this friendship algorithm. And I actually use that with my high school kids with autism. And we talk about this friendship algorithm and how you can, I mean, it's very linear and structured. And this is how you have a conversation and this is how you make friends. And they love it when I play little clips like that. It makes it fun. Yeah.
Right. Oh, that's fantastic. Yeah. And so how long can a child focus? So if you're working with like a 8-year-old or a 10-year-old, is a session an hour and a half, or is that too much?
I typically work in 30-minute increments, especially with I have preschool and lower elementary school kids. That's typically plenty of time to get my lesson in. But with my older students, or if maybe I'm working in a large group, we can work for a longer amount of time, 45 minutes and an hour.
Oh, I just assumed this was a one-on-one thing. Can you do this as part of a group?
Sure. So I am so fortunate because I have my own practice. I typically do work one-on-one unless I do really like pairing up my students with autism because that's exactly what they need. They need to work on the reciprocity of communication and communicating with each other. And then we can work on those nonverbals. Oh, I see by the look on his face that he might not be interested in this. Can you see that? And then it's so much better than just me being the teacher all the time.
Right.
We all learn from each other.
I was going to ask about so how much of this is we talked about a lot of speech therapy is physical, and now you're training someone to change tones and things. How much of this is really mental? Like how much of this would be similar to like psychotherapy?
Well, there's definitely a cognitive component. Actually, with a lot of my students with ADHD and autism, they struggle with executive functioning. And that's right here in the frontal lobe of the brain. And those are all of the skills that we need every day. The organization, the planning, the initiation. A lot of times my kids will do an assignment, they'll put it in their backpack, but then they can't initiate the movement of just turning it in. So it just gets lost in there because it's just a jumble of junk. But at the end of a week, right?
There's a lot going on in there.
Right, because they're.
But the speech pathologist takes a role in that type of behavioral.
That's what I'm saying.
That seems like a whole behavioral thing that has nothing to do with speech. So how does speech connected to that? Because I have some experience with that.
The processing, right, Suzy? The processing.
Right. And it's all an umbrella under communication. I mean, if you can't organize and sequence your thoughts, you can't organize and sequence language.
Interesting.
Mm-hmm.
So it does become wow. I guess I can see why it's fascinating because it's everything from a physical process to a muscular training process, an education process, and then it becomes this problem-solving thing. And what does that really mean when they're making all these grimaces and faces? And then you're saying it actually is like a psychological process where it's like, okay, I guess you're telling people to slow down or write things down or whatever comes into that executive function space. It seems like speech pathology doesn't do it service.
Right. That's what I told her. Very underrated profession.
Yeah.
I think you're right.
And these are life skills. These are time and management skills. These are right? Organization skills.
And it truly is incredible how much growth I've seen in this field since 2000 when I got my degree and my license. Because back then, the focus, I'd say, really was on articulation. And I mean, that was a lot of the students on our
So
caseload.
where would like an occupational therapist overlap with this? Because as I understand, I don't know much about that either, but I thought an occupational therapist would be more like the ones to teach you how to manage time and anticipate and plan and execute.
I love working with OTs. So, yes, you are right. Occupational therapists will work on the fine motor, the writing, the gross motor, all of those large body movements, even just posture, being able to sit in a chair and get your schoolwork done. And they'll also work on a lot of the sensory integration issues, the hyposensitivity. And they do work on executive functioning as well. So oftentimes, speech and OT can work hand in hand. I know there are a lot of practices around that actually have both speech and OT at the same facility, just because a student might need help from both, or even speech and OT can co-treat together. I've seen that in the public schools as well.
I wonder if I'm the only person that doesn't understand this basket of services based on how it's named.
Unfortunately, I think
not
no.
really.
I think you might be right, and I just applaud the two of you for getting this podcast out, because I want parents to know what is available to them, and I want them to know about IDEA and how they have rights and how they are the best advocate for their child. And that, yeah, sometimes you are going to have to be pushy, and you're going to have to be the squeaky wheel. But especially, and I know this was so meaningful for Gregory, and especially to get your child into the least restrictive environment, which is your right as a family. And what that means is, if your child is identified as a student with a disability in the public school system, and they get an IEP, an individualized education plan, your child has the right to least restrictive environment. So as part of their school day, you can decide as a team what environment is best for your child. Do you want your child to be in a classroom with individuals with needs that might be similar to them? Do you want them to be mainstreamed in a neurotypical classroom? And I know that Michelle advocated for the mainstreaming, which just served Gregory so well. And I have always been an advocate for mainstreaming as well. I have fought hard for many of my students for that least restrictive environment, because I truly feel that these kids benefit so much from having that model, that
Right. Learning through observation.
model, behavior model, like all the models that they get from those neurotypical kids.
Oh, that's fascinating.
Very.
I'm starting to think there's no such thing as neurotypical. I think we're all kind of.
Yeah, we are all neurodiverse.
We're all kind of like, we call some people.
I'm working on that ping pong thing right now. I'm being.
I love it. I love that you guys are going to joke about that now.
I know.
At your family gatherings.
We're gonna have, well, with our family, we're gonna have to have a stopwatch.
No, that wall button. I want to get
Your
one of
time
those.
is over. You got a chance. Your time is up. So you touched on like the parent as advocate, and Michelle is like the world class at this. So have you kind of ever thought of like how you would say you take a parent? We're focusing mainly on that moment that people discover and they try to get themselves up to speed. But like that whole parent advocacy thing, we'll do a whole show on that and bring in lawyers and talk about rights and things. But like in your practice, have you had parents that kind of didn't do enough, got it right, and then did too much?
I mean, parents have so many different personalities. There's a personality type that trust the professionals to do the best for their child, and of course you always want to trust that the professionals will do the best for their child. But again, you are the expert on your child. And if you feel that your child needs something, if you feel that your child is not getting enough of something, maybe they qualified for one session a week, but you feel that they would benefit from so much more, you can call that IEP meeting anytime you want, and you can ask for that. I mean, you can't call one every week, but
Right.
but you can.
You can, but you're not very popular if you do.
Right.
Yes, but you can also ask your team to focus on your child's strengths. I think so many parents get so discouraged because they walk into a room, and it's all about the deficits, what the child can't do. So I always feel, and whenever I start a meeting, it's always with the child's strengths and what they can do, and just to focus on that, and then taking those strengths and working with them.
Oh, that's good advice. That's good advice.
It
Yeah,
is.
because it's easy to get focused on the thing that needs work and not
Right.
appreciate the things that they've accomplished, right?
Absolutely.
Yeah. Well,
That's
it's overwhelming. You got 12 people on one side of the table, and then you're sitting there.
Hmm.
when you're in this
When you're in the
IEP
IEP
thing,
meeting, there are 12 other people.
Hmm.
and I think Michelle, you talked about some schools are sort of like, let's get to work and help this baby, and others are like, take him out of here.
Yeah, we're done. Yeah.
Yeah,
The services.
and they have a right to that. Can they say like this child's needs are beyond our capabilities?
Yeah, they totally aren't supposed to, but they can stop. They cannot offer you, I don't know, Susie, I guess how to word it, the exact services that you need.
Well, it definitely could be the case that the school that your child is at is not the best fit.
Right.
However, there has to be a better fit for the child that they're offering. A school could not say that this is not a good fit.
Right, particularly a public
You
school.
need to go find another placement, which
Right.
I know I've heard that that has happened, but a school should have options.
So it seems so. We've been thinking about this lawyer episode. We're definitely going to get the lawyer episode because it does. I mean, like the tax dollars. There's been a lot of good work done from the federal government. It sounds like, and the state governments and the local and the school districts on like building resources. But
And
I think
I have
sometimes it's just hard to navigate, right?
Right. And I'm sorry, I worked in the schools for 6 years in the public schools, and those speech pathologists, they work so hard for their students. They are on top of education. They are on top of their students' needs. There are just so many students on their caseload.
Right.
And the paperwork has just gotten astronomical. So it's just I felt overwhelmed. I had a caseload of 85.
Oh
80
my God.
students.
See, that's the
And
problem. That's too many.
yes, it was. And it was just, I was trying so hard to make a difference. And it just, I burnt out.
Yeah.
And that's a real thing. So I'm very fortunate to have gone the private practice route, and now I typically get to work one-on-one, which is a luxury.
And how many
And
do you take?
what's that?
How many do you take? What's your caseload now?
Right now, I guess I have about 27 ish.
Wow.
Yeah, yeah, which is a good. It's a great caseload. I am in close communication with the parents. I feel like I have time to create materials and get myself organized. And also, I think, Sean, that you had mentioned, do you work in a group? Do you work individually? Because the caseloads are so high in the school, oftentimes the groups will grow to 4 and 5. I mean, I had groups of 4 and 5 kids, and sometimes the goals are different.
Right.
So you're
I
having
would think that adds a whole nother dynamic to it, depending on the age of the kid. That they might be embarrassed or shut down around people because you're often
Mhm.
working with like social interaction skills as well.
Right. And that's why early intervention is so key, because in kindergarten and first grade, they all want to come with Miss
They
Susie.
don't care.
Yes. Oh
I
yeah.
wanna
Why
go.
can't I come? Why can't I come with you?
Did you see this? I think she was a beauty contestant, a really pretty woman. I think she's famous for this. She has a lisp, and she blamed it on the school's speech pathologist because
Oh,
Didn't
the
fix her
kids
or
that
what?
well, the kids that got to go outside and work on speech got Cheez-Its, and the kids that stayed behind didn't. And so she's like, "Well, if I have a lisp, I get to go out there and have the cheese." And then she actually developed the
She wanted
So
to
I guess
go.
we be careful with those incentives.
yes, you do.
Exactly.
Okay, this
So we're running out of time, but I do want in the world of every AI is going to put us all like we're all AI. None of this is actually real.
This
Um,
isn't real.
yeah, if I had AI, it'd be thinner. In a
Yeah.
world of AI and in a world of technology, are there things that what if someone can't afford a speech therapist, or their school's not good at it, or they're one of 85 kids and they're not progressing? Are there kind of DIY solutions where has technology made an impact here?
Absolutely. Actually, I just went to the Texas Speech Convention last week, and there was a whole seminar on creating therapy materials using AI, which is something I'm a little behind the eight ball with, and I'm glad I went to that session. But Michelle and I were talking about this earlier. The best thing that you can do for your child is be very aware of what they can do. I always tell my parents, start with just putting a piece of paper on the refrigerator and starting to write down all of the sounds, all of the words, everything that you hear, and do that for a good week, 2 weeks. Because a lot of my parents will come in initially and say, oh, they maybe have 2, 3 words. But when I say, please just put a piece of paper up and just start writing things down, they come back and they're like, wow, I really hadn't realized how many sounds I'm hearing. And he or she has more words than I thought. So again, start there, because then you can take those words and you can expand. And the best way to teach expansion is through everyday functional routines. Cooking dinner, bath time, getting dressed. I mean, it's take off, put on, stir, open.
Right.
And with my students with autism at the young age, a really great activity, we used to call it communicative temptations, is where you take an item that they love, like a wind up toy or something that has a lid, and you screw it on extra tight, or you kind of sabotage it, like you can take the battery out, and then they ask for the toy, which you always want them to use their language. If they're not using their language, you model it for them so they can imitate you. So once they request the toy, or even they can use sign. I'm a huge proponent of sign language, especially if you have a nonverbal child. I taught both of my children sign language right off the bat, because it's such a great way to avoid that frustration.
Interesting.
And then so if they can't get their toy, what do they need to do? They need to ask for help. And they need to come to you, which is a social communication tool. They need to come to you. They need to point, which is joint attention, which is another goal that we have in social communication. So take what they're very interested in and work from there. Get down on the floor, sing songs, play games, use finger plays, do nursery rhymes, anything that's fun. And you can use facial expressions and those voice hills,
Right.
and just make learning language fun. And when you hear them say a word, you say it back, and then you add another word. Wawa. Oh, more Wawa. Drink Wawa. Let me get you your. Sorry. You know what? I should have said water. So so you could model back
He's
Wawa, but
all
you do want them to hear that the word they use is water,
get
more
caught up in the
water.
moment.
I mean,
That's all.
sometimes yes, jump into, I have many hats.
That's
So,
awesome.
yes, but definitely model and engage. Literacy, of course, is such a great way to label and have fun together, and you're both attending to the same activity, and it's a great way to snuggle and get close, especially if you do it at bedtime when maybe the energy level is a little bit lower.
Yeah.
That's a great teaching moment. Every moment is a teachable
It
moment.
is. It's 24 hours a day, 365
Mhm.
days a year.
Yes.
Yeah.
Susie, this has been great. We could talk to you forever. This has been really
Yeah.
Oh, you can
Thank
tell
you.
I can
Thank
talk a
you
lot
so much. Thank you so
Where
much.
was that button?
I wish I should have had it right here. Usually I have it on my desk, but I'm not seeing it right now.
That's great. Well, I learned a lot. That was super, super amazing. We
Oh,
Yeah,
appreciate you coming.
wonderful. You're
awesome.
very welcome.
Thank
Thank you
you.
for having me on.
You bet.
Absolutely. All right.
Until next time.
That's right.